Greetings, I'm Dr. Kamau Kokayi, and I'm a senior staff physician here at Patients Medical. So let me tell you a little bit about myself and my approach to wellness, to illness. Now, if you're watching this, it probably means that you're not feeling too well, or you've been given a name illness, or you're trying to find some other alternative to prescription medication. Well, my background, fine, I'm a graduate from Yale Medical School, but more importantly, I've done a lot of work in nutrition. I was a vegan for 22 years myself. I've studied in Chinese medicine. In fact, I've been practicing Chinese medicine for about 25, 30 years. I do classical homeopathy, applied kinesiology, and I do energy medicine. Now, how is that relevant for you? Many times you go to the doctor, you're not feeling well. If nothing shows up on a physical or blood work, well, then there's nothing there. Or eventually, if you keep complaining, you're sent off to the psychiatrist. Most of us really aren't well, and we're not well in part because each of us at the minimum should be getting about 90 different substances in our food, 60 of which are minerals. But let's face it, our soil is really depleted. If our soil is depleted, how are we going to get the minerals that we need that prevent us from becoming ill, that prevent us from living our full lifespan of 120 years? How is that going to happen? So eventually you get named illnesses, which are really representing deficiency states, states of toxicity, or inability to handle emotional stress. So the way I approach things is really from a four-pole model, meaning is the problem mainly structural? Is it mainly biochemical? Is it energetic? Or is it spiritual? So here at Patients Medical, we'll try to identify different toxins and things, particularly heavy metals, that are actually contributing to your demise, to your loss of vitality, to the compromise of your tissues. Okay, and then there are ways using chelation, both orally and by IV, to actually eliminate these things from the body. Okay, so why not, instead of investing in pharmaceuticals, let's look at nutrients. Why not replete your body with some of those minerals that it's been lacking, right? Fertilizer, maybe 3 minerals in it. This is the food that you're getting. Animals and plants don't make minerals, right? It has to come from the soil, and then it's processed in a way that you can absorb that. So sometimes just taking minerals internally that way doesn't quite work. So we also do intravenous vitamin therapy, and you'd be surprised how many people just perk up just from mainlining nutrients, amino acids, vitamins, even some botanicals that can be given by IV. Well, if that actually works for you, what does that mean? It means that either it's not in your diet, right, or it's not even in the food that you're eating, perhaps, or you can't absorb it. If you can't absorb it, what's happening with your gut? Well, did you know, because of genetically engineered foods, and let's say grains in particular, well, they want those grains to be heartier. So the gluten content is actually increased in those grains. I have patient after patient will come in, will display gluten sensitivity. Gluten sensitivity, so what does that do? Well, one, it can set you up for more food allergies. And if you have more food, let's say you have chronic sinus problems. I mean, how many drugs and sprays can you shove up there? The reality is, it's probably due for food allergy, right? It's natural for your body to produce mucus when it's inflamed. But food allergies, gluten sensitivity, and getting back to the gluten sensitivity, pains that people have all over their body, it can affect your concentration. It can cause any number of named illnesses. The named illness piece is nonsense. And a lot of doctors, I mean, we have doctors want to name diseases after themselves. Isn't that kind of crazy, kind of ill? But we do that. But why do you want to be named after somebody? You have Raynaud's disease or Beckett's syndrome or something. You don't want to be named after somebody for a part of your body that's diseased, right? You want to find out what's going on. And it really is pretty simple. If your body is stuck in an inflammatory state, that means that it's getting the wrong kind of fuel or it's not getting the right kind of fuel. So these are the kind of things that we can help you with. Diagnostically, there are excellent ways beyond blood work, beyond the standard physical exam, using kinesiologic techniques, right, to actually figure out what the body is saying about its heart, about the colon. The body speaks, and if the physician has the tools, the physician will be able to figure out what's going on. More than that, 80% of your problems can really be figured out just from taking a history and just hearing what's going on. Why? Because once you get into the zone and you really start talking about yourself, you're going to keep coming back to what's really bothering you. You might end up talking about an old relationship. It'll just come out. The tissues will come out, but it's okay. We'll take the time. We'll give you a minute to figure out, because just from venting and talking about what's going on after you get past your initial complaint, then we can really figure out what's going on. So we use tools like kinesiology. We use craniosacral therapy. I'm not going to try to explain all these things to you, but there's so many other paradigms of medicine, models for diagnostic work, for therapeutic work. And I mean, I've just been fascinated by what's possible, what the human body is capable of, not to mention the energy medicine piece, pranic healing. You know, there was a time that doctors would just poo-poo that. Do you know that you can get, doctors can actually get CEUs, continuing education credits from energy healing? Or maybe it's the nurses that can get it. It hasn't worked its way up to the doctors. But we can do energy work with your chakras, you know, work with channels, meridians in your body. So all of that is possible. And it might be that you need more of that kind of work. Now, how many people are on antacids that are listening to this? Or they have GERD. Did you know that GERD is really a deficiency disease? That more than likely you don't have enough acid. And if you don't have enough acid, that valve between your stomach and esophagus is not going to stay closed. So what do you think you're doing to yourself by taking more antacids? What's happening to your digestion? What's happening to your ability to absorb nutrients? And ultimately then, what's happening to your life? I'm going to leave it like that, and hopefully I'll see you here in my office.